John is a retired architect who enjoys spending his days tinkering in his garage and playing with his grandkids. But over the past few months, he's experiencing frequent urination, difficulty starting and maintaining a steady urine stream, and an urgency to urinate that is disrupting his daily activities. At first, he brushed it off as a normal part of aging, but his symptoms have gotten worse over time. John's story is not unique. In fact, many men experience the symptoms of an enlarged prostate as they age. An enlarged prostate, also known as benign prostatic hyperplasia, BPH, is a condition that affects the prostate gland, a walnut-sized gland located between the bladder and the penis. As the prostate grows larger, it can squeeze the urethra, the tube that carries urine from the bladder out of the body, causing problems with urination. If you or someone you know is experiencing symptoms of an enlarged prostate, it's important to seek help. Ignoring the problem can lead to further complications, including urinary tract infections, bladder stones, and kidney damage. So, what do you need to know about an enlarged prostate? Here are some key points to keep in mind. Symptoms. The symptoms of an enlarged prostate can vary, but may include frequent urination, difficulty starting or maintaining a steady urine stream, weak urine flow, urgency to urinate, incomplete bladder emptying, straining or pushing to urinate, and blood in the urine. Risk factors. Men over the age of 50 are at the greatest risk for developing an enlarged prostate, but other factors such as family history, obesity, and certain medications may also increase your risk. Diagnosis. Your healthcare provider may perform a physical exam, urine test, and blood test to diagnose an enlarged prostate. They may also order additional tests such as a prostate-specific antigen, PSA, test or a uroflowmetry test to measure urine flow rate. Treatment options. This may include lifestyle changes such as dietary changes, reducing caffeine and alcohol consumption, medication, or surgery in more severe cases. Your healthcare provider can help you determine the best course of treatment based on your individual situation. Remember, taking care of your prostate health is important, and early intervention can make all the difference. Don't let embarrassment or fear keep you from seeking the care and treatment you need. Talk to your healthcare provider about any concerns you may have. And be sure to subscribe to this channel for more information on how to manage an enlarged prostate. And if you want to learn more about how to shrink an enlarged prostate and fix urine flow, be sure to check out the link in the comments or description for our detailed video on how to shrink an enlarged prostate naturally.